Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Hello and welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, today I have the pleasure of welcoming back Dr. Jalal Khan. Now, Jalal is the principal dentist of the Dental Station in North Sydney in Australia, and he's also the CEO of the Dental Truck, which is an amazing service that he provides. A dental truck that literally visits remote communities in South Queensland. It's a remarkable public service that he performs. He graduated from Sydney University, and Jalal loves dentistry because it combines biology, science and art, and Jalal certainly combines all of those. We've had him on before talking about quantum biology. I had the pleasure of meeting Jalal about 3 or 4 years ago, and I do consider him to be a little bit of a mentor for me as well, in that introducing me or reintroducing me to the importance of quantum biology, our relationship with light and artificial light. And it's interesting to also follow his professional journey as well. He works in North Sydney at the Dental Station in collaborating with Cole Clayton, an osteopath, and this is a great collaboration. We had both Cole and Jalal on a previous episode. I'll have links to both those episodes in the show notes. But today we really re-explore this whole relationship with the cranial bones and dentistry and the potential there. I mean, it's worth remembering that our heads, our skull, the human skull, is made up of 22 bones in most adults. That's 8 bones that protect the brain, bones like the frontal bone, the temporal bone, the occipital bone, and others. And of course, there are facial bones, 14 facial bones, like the maxillary bones, the zygomatic arch. This is a whole anatomy lesson I'm giving you here, but I'm just trying to remind you of the complexity of the bones which make up our head. And many people, many medical practitioners believe that above a certain age, maybe teens or a little bit later, that the sutures close up and there's very little or no more movement in the skull. But that is, I believe, naive at best and actually quite negligent at worst. It is much more subtle than that, and that's what cranial osteopathy is all about. It's also worth remembering that the only mobile bone in the skull is the jaw, and the jaw gives stability to the spine. So there's this whole interrelationship with cranial bones, with your teeth, with the way they fit together, and the impact that that has on a whole range of issues throughout the body, and particularly in re-establishing balance, homeostasis, and optimal health. This is kind of the subject of today's podcast. It's always great to have Jalal back. I hope you enjoy this conversation I had with Dr. Jalal Khan. Welcome back, Jalal.
Good to be here. Thank you so much for having me, Ron.
Jalal, I always like to get people back on, and I particularly like to get you back on because I feel it does me so much good for us to touch base and talk, because it's, as a practitioner, we are all on a journey from the moment we graduate. And I often say I only wish I knew as much as I thought I did when I graduated. And what I realized was that was actually the beginning of my journey of education. And I've been a holistic dentist for many, many years, over 40 years. And when we met about, I think around 4 or 5 years ago, something like that, you introduced me to a whole aspect of health that I kind of had touched on, but hadn't fully appreciated. I'm really interested to hear your journey from when you graduated, into the world of quantum biology and where we're at to up to now.
Yeah, sure. So, I mean, I graduated back in 2011 and went straight into general dentistry, but always had this curiosity that there was something more to the mouth than just repairing teeth and making sure that the gums were healthy. And so I started to dig into the mouth body connection, and started to appreciate how periodontal disease, gum disease, could have an influence on like heart health and brain health. But that still wasn't enough for me. Then I started to look into the airway side of things and the postural dentistry side of things, and that's really kind of where things have come through in my practice today. But along the way, I've kind of dipped my toes in other areas of holistic health, and you remind me of that time when we first met, and I was like this young gun, really passionate about learning. Maybe I'm still young, who knows?
You are, Jalal. It's official. You are still young.
And I was this young gun, and I was, talking about quantum biology and electrons and protons and light, and I was so excited about it because it was something which was completely new to me, really resonated with me. And I remember saying to you that, like, Ron, this is foundational to health. Like, if you don't have this right, like, what's the point of everything else? And you had that wise smile about you, and let that one go through to the keeper, so to speak, from if we use some crickety terminology. But you always reminded me to kind of keep an open mind and keep a curiosity, which I'm always grateful for. And that the last 3 or 4 years has been a really interesting journey because I mean, I've spoken on the podcast before about like the importance of light, so we don't really need to go over that. But it's been an interesting journey because it has been a journey of listening to my patients and appreciating that, like, I know a bit, but I don't know much. Like, almost I know nothing. But the body has this infinite wisdom about it. Like, every compensation that the body has, whether it's a structural compensation or a metabolic compensation, is a compensation that the body does to survive and to thrive. And it knows what it's doing. As weird as it may sound, something like diabetes is, in my world, it's like it's the body's doing that on purpose, and we just need to understand why and then unpack that. So when I started to approach patients with that mindset, I was playing a lot less kind of instructing and prescribing patients, and much more listening and asking them through their history, through the words that they use, through their body language, through their language, what was going on with them. And I started to kind of pick up on little cues and little clues and follow those. And inevitably that would always lead me down to kind of unlocking what was the thing that someone really needs, which was more often than not me, but was a referral to someone that knew more about, and MCAS, for instance, or upper cervical instability. And so it's really
MCAS, for our listener, is mast cell activation syndrome, which we've done with Christabel Yo,
yes.
And spoken about with a couple of our guests. So I'll make a note of that because I think we should re-release that one. But anyway, go on. Yes.
And so it's really been a journey of listening to patients and leaning on them to give me the clues on how to guide them. And that's been like really, really good for my heart and soul. And it's really restored me back to, humility and open-mindedness and open-heartedness. And I've just come to appreciate now that most people are struggling. Those that are struggling are commonly struggling because I feel their nervous systems are just like really overburdened. And that nervous system overburdening can happen because of like a structural issue. It could be 4 teeth being removed for braces when they were 14 years old. It could be a traumatic brain injury or whatever the case is. It can also be an emotional component, or it can be a metabolic component, or it can be that they're living out of alignment with like who they really are. And so kind of approaching things from that perspective has been really, really exciting for me, because I've seen patients who have done everything perfectly from a quantum biology standpoint, and nothing has shifted the needle. And so that really forced me to go back to the drawing board, much like in my previous podcast with you with Cole, our osteopath, when I was trying to expand jaws in craniums that were all locked up. Something was missing, so I had to go back to the drawing board, and that took me to osteopathy. When I was not winning with like quantum biology recommendations and structural recommendations around manual therapy and dental work, I'm like, what's missing here? And what I found was missing was like a lack of appreciation on my part about how much like emotions could have a role in nervous system regulation and loops that people get stuck in when they're trying to navigate their way through life. And so really my journey has kind of, albeit short, and there's still a long way to go, has been more unlearning and more relearning, and an open-mindedness and a curiosity towards kind of those 4 or 5 key pillars, which are structure, metabolism, nutrition, environment, electromagnetic frequencies, and then of course that big emotional component as well.
I mean, what a place to be. I know I've said this to you many times in our personal communication, but what a great place to be at this stage of your career with so much of your career ahead of you. There's so much you've said there that I just want to unpack. I mean, one of my mentors, a doctor who's written textbooks, who used to be President Kennedy and President Johnson's doctor in the White House, Janet Travell.
Yes.
At the age of 92, I spent a week with her in the late 80s and late 1980s. And she said to me, if you ask your patients, if you listen to your patients, they'll not only tell you what's wrong with them, but they'll often tell you how to fix it, provided you know which questions to ask and understand what they're telling you. And I think this humility that you're expressing and this, aha moment of I need to listen more is such a powerful place to be. I'm really intrigued before we dive into some of those things about, the nervous system and all that, is the journey of the practitioner as one leaves university with this incredible knowledge and knowing you know so much, because so many practitioners continue on that trajectory, don't they? There's no shortage of continuing on the status quo. I mean, if chronic disease management is what it's all about, hey, there's a whole industry there to support us. Yet some practitioners, like yourself, and I would say like myself,
Yes.
choose to look a little differently. What do you think the difference is there? I'm intrigued by why everybody isn't doing that when they graduate.
That's a really good question, and I can only speak for myself, but I just have this thing inside of me that I have to always strive to be the best that I can be for my patients, and that takes a lot of courage, I would say, because we're pushing the envelope, we're pushing the boundaries, we're sticking our necks out, so to speak, in order to try and find a truth about dentistry or a truth about holistic health, which was written many, many years ago, more often than not, but was buried in a textbook in the 1960s. I mean, for instance, like A.C. Fonda's book, The Dental Physician, like how old is that book? And if every dentist read that, dentistry would be in a much better place. So there's that aspect to things, is like a drive to do good for patients, to be our best, and I also think on a personal level, I just want to be the best that I can be, because if I'm doing a half-assed job of something, I'm not satisfied within myself that I'm giving everything I can. That's why I started to do expanders in children and then stopped after 6 to 9 months because I wasn't happy with the results. And then 2 or 3 years later, found Cole and cranial osteopathy, and then started again. So it's
This
like,
is Cole. For our listener that didn't, and I will actually have that episode in the show notes linked, but Cole Clayton is the cranial osteopath
yes,
that we did a program with called, I think it was called the Quantum Kids.
yes.
And you and Cole work very closely together in Sydney here. But do go on, yeah.
Yeah, so it's like I'm not afraid to learn and make mistakes, and be honest about those mistakes, and then be better for it. And I think that's like something which I wanted to talk about today for anyone listening, is like, we as holistic health practitioners, like, we put a lot on the line to do what we do and be the best that we can be for you. And sometimes that means we get misguided along a holistic health modality that after 3 or 6 months we realize, okay, that's not really going to work. It's never a mistake with a malicious intent. It's always a mistake born of curiosity than anything else, because we're doing the best for our patients. um, and so I think there's a huge humility to people like yourself and I, Ron, because we're okay to make mistakes, because I guess, is there really such thing as a failure or a mistake, or is it a redirection along the path? And a lot of clinicians perhaps would find that an uncomfortable place to be, because it does mean you have to like look at yourself in the mirror regularly and say, who am I? Am I stepping up for my patients? Am I turning up the way that I want to? Um, Whereas you can almost get trapped in a level of comfort in the material world as well as in your mind. If you're not stressing your mind and pushing the boundaries, it's really comfortable to just do the same thing for 40 years, isn't it?
It is.
It's really easy. But there's a few of us who are just not born for that. We've got to make a bigger impact, not for the purpose of legacy, but more so for the purpose of just helping patients.
I also think there's a curiosity there because we're not just on a professional journey, we're on a personal journey through our own health our life and how we approach our own health. And my focus in recent years has been on practitioner health. And my goodness, that is just scary when I read the statistics, particularly about mental health in the workplace. So, we as practitioners are on a personal journey and on a professional journey. And when you're in healthcare, those two are intimately connected.
It's really interesting you raised that, Ron, because 5 days ago I deleted my social media accounts, and
Interesting.
it was born out of the fact that I've kind of gone, as you touched on, like last 3 or 4 years has been this big period of like expansion in me, expansion in knowledge, expansion in expression of that knowledge, perhaps an expansion in embodiment of that knowledge. And I just felt that the last 4 to 5 months on Instagram, I was not expressing as much and I was just consuming more. And so I realized that I was becoming the product as opposed to like someone that was producing value for people. And so I decided to delete Instagram, and felt really, really good about it. My, and it's interesting because we talk a lot in our messaging about how, screens are bad for us and mobile phones are bad for us, etc. But we're delivering that message through a digital medium.
Yes.
It's
There's a
ironic.
certain irony to that, isn't there?
And so I just felt like, from a level of authenticity, etc., it was time for me to like just cut that. I don't know if it's permanent or if it's temporary, but it feels permanent. And it's been interesting just how much more present I've been at home. Um, and phone usage is like, 30% of what it was. I've also gone as far as like removing email notifications from my phone. So like the phone's not telling me when to look at it now. I'm only looking at it when I want to look at it. And it's a really empowering feeling. And the other thing that's been really interesting, Ron, is that I'm really, really deeply engaged in-person interactions now. And that's been, it may sound, well, obviously that would happen, but it has really struck me as a surprise, a positive surprise, just how much more engaged I am in in-person interactions because my phone isn't near me, and like I'm putting it away from me. I purposely leave it away from me. There's nothing for me to look at there, and I'm really just like very present in the conversations that I'm having.
We've done programs with Jocelyn Brewer, who is a psychologist who writes about digital nutrition, and she talks about 3 M's in your digital diet, and that is it should be moderate, meaningful, and moderate, meaningful, and anyway, I forget the last M, but the one that I added to that was modeling, because with anybody really, the way you model behavior of how you interact by having your phone on you the
Yes.
whole time and being distracted by it, you just become a sideshow in your face-to-face interaction with people. And so the 4 M's, and I'll think about that fourth M, but the modeling was a really important one. And I think that's a great message for you, for all of us in our interactions, particularly with our children and grandchildren, to do that. We talked also, I mean, I know we've covered quantum biology before, and I think I totally agree with you that there are some foundational things that if you don't get that right, so much else is difficult. And I would agree our relationship with light, as in sun and the earth, and the light in our homes and radiation we bathe ourselves in, is fundamental. And a good night's sleep, consistently good night's sleep, is fundamental. But remind our listener about some of the basics, because they can go back and listen to quantum biology. But if someone comes into your surgery and says, Jalal, what is this quantum biology business? Give me the elevator pitch. Give me quantum biology 101,
Sure.
just for our listeners' sake.
So quantum biology 101 is essentially a, a science that is explaining that returning back to nature and ancestral principles of living is a key aspect of healing yourself from chronic illness, because you are reconnecting with nature's frequencies. That is sunlight, that is grounding, bare feet on the grass, bare feet on the sand, ideally better if it's wet. And that allows us to grab electrons, which increases our body's charge. And when our body is more charged, we benefit even more from sunlight. We're also reconnecting with the Earth's magnetic fields. And by reducing the other aspect of light, which is the man-made light, which is artificial lights in our ceilings, in our screens, it is Wi-Fi, it is all of those, Bluetooth, those types of things. It is because what they do is they actually drown out our ability to sense the Earth's magnetic field. And so if we're able to reduce our exposure to them, wearing wired headphones like you and I are, etc., wearing blue light blocking glasses. I mean, your screen and my screen are set to orange, so we don't necessarily need to wear them right now. But those types of things are absolutely critical to restoring our body's charge. And all we're doing there is changing the inputs that are coming in, much like we can change our nutritional diet, and that can start to change the way that the gut behaves. If we change our light diet with different inputs, our body starts to behave completely differently in an electromagnetic way. That, in a nutshell, is quantum biology.
I mean, one of the challenges, and this comes back to our initial question about why doesn't everybody who graduates from healthcare facility explore some of these aspects, because there's a very, very powerful public health message, isn't there, which demonizes the sun on the one hand and says all of this radiation that you're surrounding yourself in and carry around with you is perfectly fine, no problem. Even though, as an aside, it has been classified as a class 2B carcinogen by WHO about 10, 15 years ago,
Yeah,
but that's just a by the by. It really isn't a problem. The sun is what we need to be scared of.
spot on. And how do we counter that? I mean, the way I talk about it with patients is it depends. Some patients, they're very intellectual and they love to get into the nitty gritty. So I actually talk to them a little bit about the history of, like, this tug of war in science over the last 300 years between like mechanistic principles and vitalist principles. So like we've reduced the body down to almost like a machine, and we're treating it as like boxcar biochemistry, and like each system is its own, and we're not treating the body as one. And then you've got this vitalism school of medicine, school of health, which is all about the fact that we are light beings. We carry frequency, we emit light, we and we turn light into electric charge. All of these types of things, and health is really all about chi. It's about a life force that's flowing through you, up and down, left and right. Um, so sometimes I talk about that. Other times I'm talking just into the nitty gritty of like quantum biology, and like the Nobel Prize in 2016 was for an area of mathematics. Nobel Prize in physics was for an area of mathematics called topology, and that prize showed that when you expose the body to different, or you expose any piece of matter to different electromagnetic frequencies, the behavior and shape of that matter changes. So what does that mean then for the human body? Well, if you take a human body which is which has evolved in nature for thousands of years, and within the last 100 years, we have a billion more electromagnetic frequencies than a man made than we did 100 years ago. So that's like 10 or 1 with 18 zeros or something like that. Obviously, then our matter, our body, is going to change its behavior, it's going to change its shape. And so chronic illness, in a way, is a response to, it's an evolutionary response to the changes in the field that we are living in. And then you layer on top of that the fact that like emotions are light in a way, they're energy in motion. So like the emotions that we think of are, I feel, can alter the field in which our body lives in. And so we can negatively or positively alter our own field, and hence the topology and the behavior of our matter, purely based on the emotions and how we feel about things. So I'm actually recommending a lot of my patients to read books like The Power of Now by Eckhart Tolle, or I'm reading his book right now, his more recent one called A New Earth, which has been a really nice read, because I'm hoping that they can gain these like greater perspectives of awareness, and a high level of conscious awareness through reading these books.
Yeah, no, I like totally agree. I think that when we think about the fact that we are walking electricity, I mean, literally every nerve, every cell in our body is electrical. When we generate energy in the mitochondria, it's not called the protein exchange system. It's called the electron transport system. It's
Yeah,
not called the carbohydrate transport system. It's not called the fat or the protein transport system. It's called the electron transport system. So we are walking electricity. And it's interesting. I always find it funny when I hear people going, "Oh, this earthing business, wow, that's so woo woo." And I go, "Well, yeah, isn't it just crazy? I mean, what do you think of gravity? I mean, does gravity have any impact on you?" I mean, and the obvious answer is yes. Well, hey, there you go. I just proved that earthing is important.
yeah, yeah,
And the sun is a similar one. We talked also about the fact, we've both come to this in various times in our careers, that the fact that there's so much about that nervous system, which is electrical, yes, but that nervous system's dysregulation, which impacts on people's health.
yes,
And we were both smiling knowingly that, hey, the mouth actually has a very big part to play in that. Give us a little bit of that insight for our listener that may not be aware of quite how important the mouth is, the orofacial region is in
yes.
nervous dysregulation, nervous system dysregulation.
So we've got something in health which is called the homunculus, which is a really hard word to word to say and spell. But and so with the homunculus, there's a motor homunculus, which is mapping out the parts of the brain that are involved in controlling movement, and there's a sensory homunculus, which is a map of the part of the brain or parts of the brain that are involved in receiving information from different parts of our body, like our feet, our hands, our eyes, etc., etc. And the sensory homunculus, as does the motor homunculus, has a huge input coming in from the mouth. I read somewhere, don't quote me on it, but it was something like 36 or 37% of all of the information coming into the brain, sensory information, is coming from the mouth. And if you think about just how big the mouth is with respect to the whole body, it's almost like it's not a linear setup there. Like surely the mouth should be like 37% of the body in terms of how much real estate it takes up. For it to take up 30% of the real estate on the sensory homunculus. And so that firstly points to the fact that we are non-linear beings, we are quantum beings, and that's another piece of evidence for the vitalists. But could we not use the mouth to help with nervous system regulation? And that's what I find myself doing a lot more of these days, is not necessarily trying to make jaws bigger or restore teeth, but more, let's just balance this person's nervous system. And sometimes that's with like little mouth guards, or in the children, it might be with like an alteration in the jaw size, etc. It's a lot easier in children. But what I'm finding is that children in particular, after they start treatment with myself and our team of manual therapists, they're having quite a large emotional release soon after. It might be later that day, it might be a few days later, and the parents come back at the next appointment and they're kind of they're not concerned about it. They're just reporting, well, how was your last month? Well, Annie's going great with this, and she hasn't had any issues with the appliance, but she did have a big emotional release at the park the other day. And so then we asked, well, has anything happened since? And they're like, no, there hasn't been any big emotional. In fact, her mood has improved in general. And so like these little kind of anecdotes I've just started to pull together in my mind, and what is data but a collection of anecdotes. And I've started to realize just through clinical practice and experience that like the work that I'm doing is really helping people's nervous system. For the children, it's emotional regulation. For the adults, it's just balancing stress, which is like the number one, reason that or symptom of ill health that drives all the chronic health. Whether that stress is structural and macro, or micro and quantum. So that's really been the big takeaway for me for 2024, is just how big the mouth is in as a player in managing nervous systems.
It's interesting, isn't it? Because I've read similarly that between 30 and 40% of the body's sensory nerves and the 30 to 40% of the body's motor nerves,
Yes.
that means that move things, are in this orofacial region. And I think what is unusual about this orofacial region, it's the only joint, the jaw joint, in the body that has a rigid endpoint. Like when you bite together, your teeth guide you, whether they're balanced or imbalanced, and for a lot of people there are imbalances, that locks you into this neurological input that is unchanging. It's like if every time I moved my arm, it always locked into the same position.
Yes.
And no other joint in the body does that. No, the knee, the hip, the shoulder, none. But the jaw is unique in that every time you close your teeth together, that's where you are. That's home for your nervous system.
That's home, exactly. and that's what AC Fonda described it as. Imagine what it must be like, Ron, and I'm sure you've seen patients through the years that have walked in saying, Dr. Ron, I don't know where to put my lower jaw. I don't. How do my teeth bite together? I don't know. Imagine how distressing it must be for a nervous system to not know where home is.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Well, that's for those that are aware.
Yes.
Because the same may be said for those that aren't aware of that it's just become normal. It's like, when you ask people about sleep, how do you sleep? Oh, no, I'm fine. Do you wake up feeling refreshed? No, but that's the way I sleep. Well, that's not actually the way you should sleep. And I mean, this is the thing about the imbalance. So the other thing about cranial which I find fascinating, is the subtlety of these cranial bones. And I think a lot of people also may not be fully aware of what cranial adjustments and craniosacral work is all about. How does one explain that to somebody who's unfamiliar with that concept?
So the cranium is a complex of 22 bones, and there's 14 bones in the face, and there's 8 bones in the head, or the back of the head, and they're all working together, and they're all moving in sync, and the different bones have different styles of movement. And that movement is doing a few things. It's pumping cerebrospinal fluid up and down the central nervous system. It's draining lymph out of the head. And it's ensuring that life force is flowing through the entire central nervous system. It's essentially the first kind of form of breathing that our body has in utero before we actually are exchanging oxygen and carbon dioxide when we're born. So this craniosacral mechanism, movement of the cranial bones in sync with the tailbone, the sacrum, is foundational to health. And coming back to the journey over the last 3 or 4 years, quantum biology is one huge foundation. Optimal craniosacral mechanism is another huge foundation. Then, of course, optimal nutrition, seasonal, local, grass-fed, all that type of stuff. But that's essentially what that craniosacral mechanism and cranial osteopathy is about. It is about removing compressions within the cranium so that life force, lymphatic drainage, cerebrospinal fluid can flow better. Because the cranium is essentially a box with a brain inside of it, and that brain wants to be as comfortable as possible. And if it's squished in one part because of the compression in the cranium, then there's less electrical flow to that part of the brain. So we've had patients who, like, over 3 or 4 months, we've been able to release the occipital bone compression. And the occipital bone is at the back of the head. And that is, for anyone that knows a little bit of neurology, that's the part of the brain, the occipital lobe, which contains the visual cortex. So all the information coming into the eyes is translated all the way back to the back of the head, that part of the brain. And so we are seeing patients whose vision is improving as we release the compression at the back of the head. So it's allowing that part of the brain to breathe better, to allow more fluid and electricity to flow through it. And then that reverberates through to the front of the head, and then the sensation into the eyes improves. So that is quite a powerful example of just how profoundly important cranial osteopathy and optimal as a modality and optimal craniosacral mechanisms are to health. The cool thing though is, sorry to jump in, is
No,
that
no, go.
the mouth can help to turbocharge that whole thing, because as you said, it's like this closed system. It's like there's a stop, and so what stops us from like breaking our jaw joints when we're biting on something hard is the fact that like we've got arches that are biting against something hard. So you've got the lower dental arch biting against the hard upper teeth, and you've got the upper dental arch biting against the lower teeth, which are obviously tooth enamel, which is hard. And so when you have an arch hitting something hard, much like the arch in your foot when it hits the floor when you're running, you don't break your ankle. The arch takes the force of the earth and springs off the earth for you to then land onto your left foot. So we've got an arch hitting something hard, creating that spring force. That happens in our head when we bite together. And so what the cranial osteos are finding working alongside dentists is that it's making their job way easier, because when a patient, whether it's an adult or a child, is biting against a mouth guard or a mouthpiece or whatnot, the whole head is like completely decompressed, and then they can get in there and do their gentle manipulations and get things flowing nicely. And it's almost like that mouthpiece or that mouth guard acts like a little bit of a memory chip, and the head remembers what it's like. So when that person puts that in their mouth when they go to sleep, the whole head resets to the way it was at the appointment, and it's like they have cranial osteopathy overnight.
I mean, it's probably also, we're talking about the fact that there are all these bones in the head and that the jaw joint uh, is this unusual joint because it's got this rigid endpoint like teeth. But it's probably worth reminding us too the fact that, we take for granted that we have 5 fingers on each hand and 5 toes. I won't put my feet up on the screen, but five toes on each foot. And for, I would say, 99% of the population, that is the case. And we've also similarly evolved to have 2 eyes and 2 ears and 2 nostrils, etc. We've also evolved to have 32 teeth. And those 32 teeth are what we've evolved with over millions of years. And yet, if I was to say to you, how many people come into your practice over the last 10 or more years and that have had all 32 of their teeth through and in perfect alignment, giving great balance to this cranial structure? How many people would you say that would fill that, tick that box?
I'm going to say less than 10%, and I'm being generous.
Yeah, I think you are being generous.
Probably probably
Yeah,
less than five
yeah,
percent.
yeah, which is an extraordinary thing. I mean, thank God the body is, well, I don't know what I call it, but thank goodness that the body is, as resilient as it is, because that would suggest crowded teeth and narrow jaws, which would set you up for cranial problems and problems for the nervous system. I mean, it's an accident waiting to happen, isn't it?
It is, and it's almost like a nice reminder of just how adaptable the body is. And so when someone comes in, I mean, I'm sure you've seen patients I certainly have, where like you look at the mouth and you're like, geez, this isn't textbook. Like, I'd love to do this, and I'd love to do this, and I'd love to do this, and if we could move this here, etc., etc., it'd be a beautiful mouth. But you step back and you talk with that patient, and like they're in like great health. Like
Yeah.
they're emotionally really solid. They've got a really balanced nervous system. Their nutrition's great. They're not in any pain. They've got a massive smile on their face. Their oral hygiene is great. What's there to change? And
Yeah.
it's just a beautiful representation of just how powerful the body's ability is to adapt. And so, if we're going to make change in the body, at least from a structural standpoint, we have to use forces that are biomimetic, that are mimicking the forces that biology itself uses, rather than mechanical. because mechanical is going to lead to failure, whereas biomimetic is going to lead to something a lot more gentler, which the body can work with because it's a physiological force. And that's kind of the big premise behind the types of appliances that I use.
Yes, because nature has provided us with a fabulous orthodontic appliance in the tongue, hasn't it?
Yes,
I mean, that the tongue and the cheeks and the lips are our built-in orthodontic appliance.
that's it.
If they are working for us, not against us. So let's talk a little bit about that, about how things can go wrong. I mean, like even from birth, what are some of the things that can cause imbalances where people aren't within their adaptive capacity?
I would say the big one is breathing. So I read a book called A Touch of Life by Robert Fulford, who's an osteopath.
Hmm.
It's an old book, but really simple read. Like, it's not written for health practitioners. It's written for anybody. And one of the biggest takeaways from that book was like a question which I now ask everybody, no matter what their age is. If they're an adult, I'll ask, did your mum ever talk about if you had a big cry at birth? And for the young children, obviously the parents bring them in. So I asked mum or I asked dad, did Johnny let out a big cry when he was born? And if the answer is no, then for me it's a primary breathing case more often than not.
Interesting.
And the reason why is because Robert Fulford explains in the book how when we are born and pass through the birth canal, obviously we're picking up microbiome from mum, which we know about. But what's also happening is like there is a shaping of the cranial bones, and there is also kind of like a crumbling of baby, like baby gets squashed, etc. As baby comes through. And when baby comes through squashed and crumpled and is finally born, the big cry is the reinflation of the entire system. And so if baby's born not breathing, or they're born blue, or they don't let out a big cry, or there's fluid in the lungs, or whatever the case is, and they never get that big cry early in that like first few moments, then it's a primary breathing case. And more often than not, those children, those adults will have breathing mechanics which are completely inverted. So like the rib cage might be, tied to intercostals, first rib, or and like there's a lot of breathing through here, and I mean the that's why I work with the osteopaths, because they're able to pick up the inverted breathing patterns or the less than ideal breathing patterns like very easily and make manual therapy adjustments to correct it. And then like it's amazing just how much. I mean, we've had instances where children haven't been able to breathe through their nose, and then like there's a bit of a rib adjustment and a this and a that, like on the torso, and all of a sudden like their mouth breathing is like way less, and the volume of air they can breathe in through the nose in the clinic 10 seconds later is way more. So, I mean, those little experiences that I see in the room working alongside the manual therapist is like profound for me, because it makes me realize that breathing is really central to a lot of issues. And then the breathing, sometimes it can be a structural insult, like not having that big cry, but sometimes it can be a metabolic insult because a child is having too much gluten, and that can be inflaming the nasal passages and the sinuses, or it could be a dairy allergy or some sort of other allergy, environmental. So those are the considerations that go through my mind.
Hmm. What about with so many people now being born, cesarean and not having that squeeze?
Yes,
That what does that, what what are some
from
of the challenges that presents?
from my knowledge, it's more of a factor. It's definitely a factor, but it's more of a factor when it's an emergency C-section, because a lot of the time the child has kind of engaged in the birth canal, and so their head's engaged, and then there's an emergency C because of like a failure to progress, for instance, and then the baby is delivered through the tummy, and so there's like a double vector. There's like an engagement, and then there's like a pulling back out, which creates like a stretch or a suction on the head, and so that child is then born with multiple vectors running through the cranium. And like the first stop after hospital is cranial osteo, and a few sessions. Um, I won't recommend how many because I'm not a cranial osteo and every child is
Mm.
different, but like some regular visits to the cranial osteo very early on is going to, or any cranial worker is going to help remove those vectors and restore optimal cranial mechanisms, which then sets that child on course to if they're less than 1 years old, to then start to grow the face and the jaws a lot better. I mean, one thing that's crossed my mind a couple of weeks ago, Ron, with tongues and tongue ties, is that one of the major nerves that runs through to the tongue is the hypoglossal nerve, which is the 12th cranial nerve that drives motor movement of the tongue. But the hypoglossal nerve actually runs like right through the middle of something called the occipital condyle, which are like the two legs that the whole head sits on when it sits on C1. So right through the middle of the condyle is the hypoglossal nerve. So what if like the occipital condyles are compressed at birth or growing up because of a bump on the head, and that squishes the hypoglossal nerve, which then restricts tongue movement. So like the point of all of that is to say that sometimes a tongue tie is a tongue tie, but sometimes it's a hypoglossal nerve compression. Sometimes it's just a fascial tension. Sometimes it's a fascial tension that's not in the tongue, it's in another part of the body, because we know that the tongue is connected through this deep anterior fascial line all the way down to the big toes. And so we as dentists aren't taught all of these things, right? If we know about them, then we can point people in the right direction towards at least crossing that off the list. Okay, the occipital condyles are fine, the fascia's fine, the breathing's fine. Maybe it's just a tongue tie, and let's deal with that. And then, firstly, can we deal with it with biofunctional therapy first, an orofacial muscular retraining, or do we need to do some sort of snip? So yeah, the last 3 or 4 years of journey has just been knowing as much as I can about all the different possibilities and potentials, and then pointing parents and patients in the right direction.
Well, I mean, to work in as close a team as you do with Cole Clayton and other people in the structural world, and to have this humility and open mindedness, wow, what an opportunity to learn.
It's been an absolute game changer for my career. And I feel like I'm in school again, just not dental school, but like just, whole body health school, because I'm always learning. I'm learning from my colleagues, I'm learning from the kids and the parents. And here's an interesting thing, Ron. Have you ever had a day in clinic where like you've done the same procedure like 5 or 6 times and you're like, oh, well, like today just must be a day where I'm working on the upper right first molar the whole day,
Yes,
you know?
yes, yes, yes. It has happened. It has happened.
So we have that in the clinic in the Quantum Kid, where it's like we have like 7 patients in a row where they all have an inferior vertical strain in their cranium, or they have like, or it might be like a side bending rotation to the left, and really it's kind of the body's infinite wisdom, because we are all one. We're not individuals. We are all one. It is that that collective wisdom, that collective consciousness, telling you as a clinician, this is what you need to learn today. This is what you need to master today.
Interesting. That's an interesting way of looking at it, Jalal. I like that. The other one, of course, is tongue. You've mentioned it a couple of times, but the tongue plays such an important role in making sure that we have enough room for our teeth. What can go wrong? I mean, you mentioned the hypoglossal nerve, which supplies it, and all of that. But swallowing and breathing are also very important, aren't they?
They are, I mean, tongue position whilst breathing is a huge driver. We don't spend much of our time throughout the day with our teeth together, but we are breathing 20,000 times a day. We are swallowing a lot of times a day. I can't remember what the exact figure
I
is.
think it's around 500 to 700
Yeah.
times a day.
So and what that does to the cranial base is quite profound. It's like it's not just swallowing to get the bolus of food down. It's a pressure on the base of the cranium at the spheno-basilar junction (SBS), SBJ, to continue to pump that craniosacral mechanism from underneath. And in the kids, that drives the growth of the upper jaw. So, I mean, the tongue is instrumental in dental arch form. It's instrumental in cranial decompression. It's instrumental in swallowing, and it's instrumental in breathing as well, because that pressure of the tongue up against the roof of the mouth helps to decompress the nasal sinuses and all of the lacunae that line the sinuses in the nasal cavity. So it's no mistake that 5 of the 12 cranial nerves, 5 of the 12, have some sort of interaction with the tongue, some sort of supply to the tongue. And let me see if I can get this right. The hypoglossal nerve, the glossopharyngeal nerve, the vagus nerve, the facial nerve, and the trigeminal.
Well, listen, I'm sure the listeners will be so relieved that you were able to list them out. I got to tell you, that's impressive. I thought you put yourself under undue pressure there, Jalal, but that's okay. You got it. You got there. Breathing is another one, isn't it? Like we ask our patients, are you a mouth breather or are you a nasal breather? And from a cranial perspective, that's important.
It is 100%.
Tell us a bit more about it, though.
So with breathing, are you referring to like just the mechanics of the rib cage?
No, I mean positionally, tongue again.
Yep.
Using these forces for us, not against us.
Yep. It really is that upwards pressure of the tongue against the roof of the mouth, and then the swallowing behind that decompresses the entire skull, gets the temporal bones moving. If you look at the anatomy, the tongue actually hangs like a sling between the two temporal bones. It's like a hammock almost between the two temporal bones, and it's used to stabilize the two temporal bones, and then it's almost like a rudder for C1 as well, because like when someone's C1 is off to one direction, more often than not, you just see the tongue kind of tipping in one direction to follow the C1. So it's like this central player in the game of the cranium from a muscular and force delivery standpoint.
I was one of the real aha moments for me, and you've mentioned C1, the first cervical vertebrae, a couple of times here. When you look at vertebrae throughout the body, there is a kind of a tripodization that occurs that gives each vertebrae stability, except C1.
Yes.
And somebody said, I remember being in a lecture a long time ago, and somebody said the jaw tripodizes, stabilizes the first cervical vertebrae. And I thought, wow, that is big. That is a big statement. And that is a really important statement, because there's a whole area of chiropractic which says if I can get the first cervical vertebrae stabilized, everything else will fall into place.
Yes.
Have you heard that? They call them the hole in one. I think they're called.
So there is a school of chiro called the NUCA chiros,
Okay.
and National Upper Cervical Chiropractic Association, born out of the US. But I completely agree with you, because if you look at the shape of the mandible, the lower jaw in cross section, it's almost like a triangle, right? It's almost mimicking the shape of the lower vertebra. So that is definitely my feeling as well. And I mean, one of my patients unfortunately had a high velocity adjustment with a manual therapist, and her C1 slides to the right quite a distance, and as a result, as a body compensation, her lower jaw is like quite literally like off to the side by, if anyone's watching, I'll try and mimic it, but it's like, so it's almost like a 3 to 4 centimeters off to the left to compensate for the C1 that's going to the right. And she was referred to me by a NUCA chiro, which was great, because they're obviously understanding the way that the jaw is playing a role here. And she was having to press her finger on the right side of C1 and push it back in order to hold her jaw in place.
Wow.
And the poor thing is, she's a mother of a young boy who's like, 1.5 years old, and like you can't care for your child and be a present wife and work and whatnot, walking around like this. So we made her a device for her to wear on her lower jaw, which supported the lower jaw and sent a bit of a spring force to mimic the tongue through the lower jaw. And it took us a bit of toing and froing, but within a couple of weeks we got it right. And like she's like almost not dropping out now. Like her C1 and mandible is now stable, which is quite profound because I had made no promises to her because I'd said, look, I've never seen anything like this. I'm just going to try something. And it was my third go at it, but we finally got something that has worked for her, which goes back to like a nice full circle back to our original conversation, which is like, we do our best for our patients and we try and we test and eventually we get something that works right because we have the humility to be okay with making mistakes. And she was totally cool with it. She said to me the other day, she's like, Jalal, the thing that matters the most to me as a patient is that you and Cole have never given up on me. And like that literally just, I was like almost teary because we very rarely get that type of feedback as clinicians where someone actually sees us for how hard we're trying to be the best for patients. But that is a beautiful representation of the C1 and lower jaw and how strong the relationship is.
Yeah, that whole area of chronic pain is so frustrating, isn't it? And for people who suffer from chronic pain, who have gone off chronic musculoskeletal pain like headache, neck ache, backache, jaw ache, and they've gone off and had every MRI and every CAT scan, and the doctor looks at them and says, "Hey, listen, there's nothing wrong with you. It's all fine. It's all normal." That is just such a tough thing for someone to hear who's suffering from pain. Whereas with a little bit of humility, perhaps that doctor could have said, "Do you know what? I don't know what's causing you this pain." And what a liberation that is for the patient and actually for the practitioner, truth be known. The thing I like about the craniosacral approach, and you mentioned this person that had a high velocity, you're talking about a cracking
Yes.
to manipulate the neck, which I've always felt very uncomfortable with. I mean, one could say, oh, look, maybe once or maybe twice, there's a place for it. But if you're going for a manipulation once a month, oh my God, that scares the hell out of me. What I love about the craniosacral approach is the subtlety of it.
It's beautiful to watch them realign a C1 with such gentle touch. And it's as a third party, so to speak, because I'm not the patient, I'm not the clinician, but as someone that's just watching, it's like it makes my heart feel warm just knowing that like that C1 is being treated like that,
Yes, with the respect that it deserves.
Exactly. You think about like all the nerve flow and all the blood flow through that C1, like it's just insane.
Yeah.
To think that like those high velocity cracks are a regular occurrence for some people.
Jalal, I always love talking to you. I want to just finish up someone was listening to this and that was one other thing I wanted to mention about. We've talked about cranial movement and movement of cranial bones. And I think this is where people have a little bit of a problem. And I think it's a semantics issue. Like, for example, if I lift my arm up, that is a movement that is very easy to see.
Yes.
But if I pressed on the table that I'm sitting at the moment, you wouldn't describe that as moving the table. But if there were pressure sensors on there sensitive enough, they would see exactly where my finger is impacting on what doesn't appear to move.
Yes.
And I think this is what cranial motion is about, is that it is so subtle that we can get bogged down in the semantics of, hey, come on, how can you move a cranial bone?
It's such a good point you raise, and I mean, we as dentists would find it very difficult to appreciate this because we're taught about like the mechanistic approach to things, like there's drilling and there's filling and there's macro movement of teeth, etc., etc. But I have felt the heads of patients with like optimal cranial rhythms after like 12 months worth of treatment, and like my hands are very untrained when it comes to cranial palpation,
Yeah.
and I can feel it, and every time I feel it I'm just like, wow, like how profound is that? And you can almost understand why the osteopaths love what they do, because it's quite a profound feeling to be able to feel someone's life force flow through their head. And it's a privilege and a gift for them to be able to feel that, and almost makes me want to go and learn how to do it as well. But as someone that's very untrained, that is far from the inner circle of osteopathy, I'm a trained dentist. I felt heads. It's there. Like it genuinely is that movement. It's very subtle, but it's there. And when you feel it, it's profound and it's life changing.
Yeah. Now, listen, as I was going to say, it's always great to talk to you, and it always is, and I love getting you back. It's
Thank
good
you.
to share you with my listener. If someone was listening to this though and was thinking, maybe I should. What should I be looking out for? What would be some advice that you'd give a person who was interested in exploring this a little bit?
Um, I would think about, well, first, do you have any aches or pains in your body, any part of your body? Because the mouth could certainly help. If your sleep quality is a little bit down, if you wake up tired or you wake up a bit groggy, or maybe there's like an element of like poor quality sleep, it's fragmented sleep, it's insomnia, for instance, because sometimes that's not just a structural discussion, that's a discussion about blue light and electromagnetic frequencies and central nervous system regulation. So think about your sleep. Think about your breathing. Are you mouth breathing? Are you nasal breathing? Do you wake up with a dry mouth? Think about if you have any pain or tension in your body, particularly necks, traps, upper back, tailbone, hips, and finally think about if you've got headaches or migraines, and if that's affecting your quality of life. Because in the postural / functional dentistry landscape, which is a little bit different to biological dentistry, which has its place, but my hat is more the postural functional dentistry. Um, those are like a lot of the common things that I help patients with.
Well, Jalal, that's a great note for us to finish on, and I will, of course, have links to your clinic, and I want to thank you again for joining us, sharing your knowledge, wisdom, and your personal and professional journey that we are on through life. Thank you so much.
It's a pleasure to be on again, Ron. Thank you so much for having me.
Well, it's an interesting statement, isn't it? Because I do know that when I first met Jalal and he was really getting into the whole quantum biology area and being inspired, as I have been too, by Dr. Jack Cruz, who's a neurosurgeon, formerly a dentist, an oral surgeon, a medical practitioner, and now a neurosurgeon, but is known worldwide for his work in quantum biology, EMF, radiation, the effect of blue light, the importance of sunlight and earthing on our well-being. And it was interesting when I first met Jalal that he thought it was the be-all and end-all of all things. And I cautioned him at that time because I do have a very open mind. I love learning new things. And the more I learn, the more I realize I don't know. But I've always found the challenge is not necessarily to decide what is right and what is wrong, but listen to it with an open mind, with common sense, with some understanding of how the human body works, and work out how each part contributes to the other. And that's why nutrition is still important. That's why sleep is still important. That's why movement is still important. And that's why getting your light relationship with light is important as well. And that means not just the sunlight, but the blue light that we bathe ourselves in continuously. But here, Jalal is returning to his roots in dentistry and also looking at the impact that he can have on cranial bones, on neurological health, on homeostasis, and on people's just good health and well-being. We'll have links, of course, to his clinic, the dental station, and I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well.
Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness, from self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.